Hello, everyone. Thank you for your patience and welcome to the webinar titled Migrating from Oracle AERS to Argos Safety, Reasons for the Move, presented by Perficient's Dr. Rodney Lemery, Director of Safety and Pharmacovigilance. I'm Eugene Stefanov, the Marketing Manager for Perficient's Life Sciences Practice, and before I turn it over to Rodney, I'd like to go over some housekeeping items. During the presentation, all participants will be in listen-only mode. However, you may submit questions to the speaker at any time today by typing them in the chat feature located on the left side of your screen. Please state your questions clearly, and keep in mind other webinar participants will not see your questions or comments. Nonetheless, your questions to the speaker will be addressed as time allows towards the end of the presentation. If you still have unanswered questions after the webinar, or would like to request information about our services, feel free to use the contact information on the various slides throughout the presentation. You can also fill out the contact form on the Life Sciences section of Perficient's website. Please note that today's webinar is being recorded and will be sent to you within 24 hours. A link to the PDF version of the presentation will also be included. This concludes our housekeeping items. I would now like to turn the call over to Dr. Rodney Lemery.
Good morning or afternoon or even evening, depending on where you are and joining us. So thank you for joining us on our webinar today. I just wanted to take a few minutes to explain who Perficient is. We are a large, now global consulting firm focusing on information technologies. And as Eugene stated earlier, this presentation is being sponsored by the Life Science team here at Perficient. We've been in business for quite some time. We are a public company and have around 2,100 colleagues worldwide. We focus on business solutions as well as technology solutions around a very large, robust, diverse portfolio. And again, as Eugene stated, we are the life science team at Perficient, focusing on clinical and pharmacovigilance applications and business expertise. So we have within the life sciences a clinical trial management space, a clinical data management and electronic data capture space, the team that is part of my group, which is the safety and pharmacovigilance team, and finally a clinical data warehousing and analytics team. We have a wide portfolio of services that we offer within those four arms within the life sciences. And again, I head the safety and pharmacovigilance team here at Perficient. So I'm sure you all registered for this and know what you are getting into, but I wanted to take a few minutes to discuss with you all some of the things that we've seen over the past many years working with both the Oracle AERS application and the Oracle Argos application. I've taken the time to provide screenshots that show some very stark differences between the two applications, and we will spend some time going into the reasons that people might want to contemplate migrating off of the Oracle AERS platform and onto the Oracle Argos platform. I'm going to focus the discussion basically on two aspects of the system: usability from a business user's perspective and usability from the administration perspective. I recognize that this lecture is pretty focused just on the business view, leaving out the IT view altogether. In the end of the slides, I will attempt to remedy that bias and talk a little bit about some of the technology stack differences between the AERS and the Argos application, which also may be a reason for migrating off of the AERS application and onto the Argos system. So this outline here will show you all of the aspects of the application that are just the very large noticeable differences between the two systems. These are not comprehensive, And I should also mention that many of these slides, while I tried to be factual as much as possible, do rely on some subjective analysis as well. So I am basing that off of my team's experience between the two applications and also our clients' perspective of those two applications over the past many years working with both of them. So I would like to start by looking at just the business side usability of the system, and there are a number of stark differences when we look at the AERS and Argos application. The first we'll focus on are just general case management, graphical user interface differences. There are a number of contrasting aspects of the AERS application and the Argos application. There are some very noticeable differences in the two systems' ability to perform medical and drug coding, and we will look at those as well. Argos, and again, remember this subjective warning that I gave, arguably has an improved document management capability within the native application. It, for example, can, out of the box, integrate with Documentum. And many times I hear, not only from my team members, but also those we service, that the attachments within Argos are far easier to maintain. We'll also look at the expedited report tracking capability. So these are the individual case safety reports and how the two screens differ within the applications. The medical review window, which is very special to Argos and, to be honest, is a very key selling feature of the application when we do demos or potential pre-sale calls with clients. So we will look at that aspect. We'll also look at the E2b support. The Argos application has a very nice tracking mechanism built into the application so that users may track their electronic submissions. And this becomes very important for global companies where non-FDA regulatory authorities have for many years now required the electronic submission of individual case safety reports. And now, as we look at the final updated rule from the FDA, post-marketed surveillance cases as of June 10th, I believe, 2015, will be required for the FDA for anyone doing post-marketed safety. So this E2b mechanism becomes quite important for a safety software to accommodate. And again, arguably, Argos has a dedicated methodology to tracking and submitting these things, unlike the AERS application. We'll also take a peek at some of the dashboards that come with the Argos application, which again, very different than the AERS application. Arguably, AERS comes with an integration to the Oracle Discoverer tool. We will see some of the ad hoc listing and tabulation capabilities of the Argos application in this discussion and how those compare and contrast with the Discoverer tool. We'll also look to a very unique component of the Argos application that simply doesn't exist in the AERS application without some heavy configuration, called work lists. And work lists are a way that people can keep track of all of the case management workload that they have assigned to them throughout their work week, month, year. And also Argos J. So Argos J is now integrated fully with the English version of Argos, and there are some very interesting features and functionality of Argos J that simply are not available in the Japanese kanji enabled view of AERS. So again, keeping in mind the subjective warning that I gave prior, we have heard over time that the general interfacing between the AERS application and the Argos application are quite different. And as a former AERS user, I can just give my opinion on that, and I do agree with that. It is a little easier to navigate through the Argos application. The fields are ordered in a more clinically intuitive manner. The tabs along the top of the case management screen in Argos are fewer in number than the tabs along the AERS application. Some information that you would expect to see in centralized screens in AERS are actually duplicated across 2 other tabs or more, and this sometimes causes confusion. This type of field duplication just does not occur in the Argos application. So again, in general, in an opinion format, there are fewer tabs. The fields are a little more structured and well organized in the Argos application. And again, remember subjective opinions here. One of the key features of a safety system is to actually enable and empower the case managers to perform their required assessments between the events and the various products that are administered to the patient, or to the participant, I should say. Here we can see the screen from Oracle AERS that shows you all of the product names and the individual event that needs to be assessed against each of these suspect products. The screen is enterable, it's understandable, it's just a little busy and probably could have been a little more intuitively built. This, again, is all opinion, but if you look at the Argos application screen that performs the same functionality as the AERS application screen, I believe you'll note that the Argos application is far more intuitive. There's color coding. As one of my technical team members pointed out, and this goes to the IT differences between the two, AERS is built on an older Oracle Forms technology platform, and Argos is utilizing a wide variety of other software, but mostly ASP pages, which give you this additional look and feel that has some technical capabilities that the Oracle Form technology simply lacks. So there is some definite increased ease of use, if you will, between the two systems. The other important point here is that many times users will need to go down to what we call local labeling within the event to product assessment screen to look at all of the places in the world this particular product is marketed, and will oftentimes want to be able to control the listedness at that level. The Oracle AERS application accommodates this, but with a drill down. So there is a drill down for local unexpectedness, and a rather complex screen appears showing you all of the marketed licenses for this particular product, and then allows you to place your anticipatedness or expectedness into the appropriate field. In the Argos application, it is the exact same screen that we were looking at before. You simply click on the plus sign for the licenses, and the individual licenses expand down below, giving the user the ability to code the local labeling. So again, I would argue that this is a far easier interface, no drill down, everything is right in front of you, which can also have an effect on the speed in which cases are entered and managed. Argos has some unique characteristics that AERS doesn't even have. So the first would be a type ahead feature. This will allow a user to type a letter, and if the field is linked to a drop-down or a list of values, then the list of values will automatically display and show you the various values that meet that criteria. So in this case, anything in that list of values that starts with the letter S. So again, just a stark difference between the Argos application and AERS. One of the really nice features of Argos is that you can quickly go back to any of the cases that you last accessed. So there's a menu selection, and I can look back at any of the various cases that I have previously been working on. Along that same line is a very, very distinct feature that we hear all the time that people want in Oracle AERS, and that is the ability to have multiple cases open simultaneously. Now, Argos can accommodate this, though it is important to note that even in Argos, you will not be able to pull open the case entry form for both of those cases simultaneously. But you can toggle between the various cases that you have opened at any given time. And that, again, is also from the Active Cases menu path, but now your active cases show as numbers above the last accessed case list. So this is a large improvement from the AERS application, and honestly is a feature that we hear people want in Oracle AERS frequently. There are some very big differences between the coding systems used between the AERS application and the Argos application, and this might get into a little bit of technical discussion, but first I just want to show you the usability. So the top screen shows you the AERS application for an uncoded verbatim term. So in the AERS application, as it is integrated tightly with the TMS system out of the box, it will pull open the TMS interface and ask the user to locate the medical term in the Medra dictionary, and then gives them the ability to classify or code the medical term. Argos has a arguably far simpler integration to the dictionaries, and as a result, it's a little more intuitive to locate and find the appropriate LLT that you are trying to code your medical term to. Similarly, when integrating to the WHO drug dictionary for drug coding, again, the drugs are coded in the AERS application against the TMS system, so the same TMS coding window appears, and the users are asked to query the TMS repository for drug terms that are present in the WHO drug dictionary. There are some mechanisms in loading the WHO drug data into TMS that have been accommodated through the WHO, etc., and it causes some awkward data to appear in the WHO drug dictionary values. Things like what you're seeing on the screen, the Tylenol PM with a drug record number after it. This does not happen in the Argos application, as it will split out, especially if you load the C format, it will split out the medical drug codes into separate lines, each one representing, for example, a different ATC code, and it facilitates the picking of the appropriate, in this case, aspirin term, based on the clinical information that the case manager has in-house. So there are some definite improvements in the visibility of the data between the two systems, and also just, again, the usability. Additionally, in Argos, we have a really nice feature where at any point we can locate a case and access that case's coding review screen, which will give us a single screen that shows us all of the medical terms that have been coded or are needing to be coded, and we can perform all of that coding right from this central screen, just as though we had opened up the case and gone to the Events tab. So this is a very interesting way to accommodate a central coding group who may be responsible for coding multiple cases at the same time. And it also is just a nicer way to view the case data when you have your coding hat on. I should mention that Argos out of the box is not integrated with a complex dictionary management system such as TMS or DS Navigator, and this results really in far less complexity in the dictionary management side of things. So this slide is a little technical, but the recoding efforts and the dictionary versioning efforts that are involved in TMS are far more complex than the default capabilities of Argos. And just to kind of emphasize that, within our team at Perficient, we have certain people that can do TMS dictionary versioning, and no one else can really do that. And then for Argos dictionary versioning, anyone on the safety team, the safety or pharmacovigilance team, has been trained and can perform that type of work, as it is far, far less complex. This may translate into a bit of a cost savings for a particular company in terms of personnel being hired or the involvement of third-party vendors to perform the work on your behalf. So you simply don't need those things when you are using the dictionary management tools that are inherent to the Argos application. Just a note here, the Argos application can naturally integrate to DS Navigator out of the box, and there are install instructions to show how to do that. It's important to also note that it can integrate to any external dictionary management tool using web services. TMS is one of those options. So now let's take a brief second and look at the ability to attach records to the case. This is an important aspect of case management work processes. Usually we would be attaching the source documents here, be it a discharge summary report, a hospitalization record of some kind, patient laboratory records. It could be anything. It depends on the type of case. The originating literature article, for example. In this example, I'm showing you how very easy it is to attach files in the Argos application. So there is a button on the Additional Information's main tab. It's Attach File. When you click it, it opens up a window, an inherent Windows, it looks like a Windows browsing application. So it's very intuitive to anyone who's been using a Windows machine. You click the Browse button, and then you can locate your source file, in this case an MRI result, on your desktop or a file share, etc., and you click Open. And this now, once we go back and click OK, will natively be stored right with the case data. And you can see that here in this record. I'm able to give a description of the attachment, keywords so that I can search on this later on, and I can even classify this as a particular source document, or in the case of E2b transmissions, sometimes the files will need to be submitted with the E2b, and we can classify this as an E2b attachment file. Here you can see if I just click on the JPEG image here, it opens up a separate window and it actually shows me the MRI result right here in the screen. It should also be noted that Argos does natively integrate with Documentum, so if you wanted a more robust or advanced document management system, Argos can comply with that as well. If we contrast this to the AERS application, the portal technology is what is used to house all of the folders and images, and while we can create these things from the AERS interface, it's still very, and this is an argument, it's still very complex and takes a little bit of technical knowledge and a lot of user training in order to get the attachments where they need to be. There's also a wonderful key selling piece of the Argos application called the medical review screen. And much like the coding review screen, this medical review screen will display the case in a central window and allow a medical reviewer to see all of the key data points that he or she would use when assessing the case from a medical perspective. So here you can see on the Medical Review tab within this window, I see the narrative for the case. I see any case comments or specific company comments. I see all of the case level assessment. I see the individual event level assessments. And it's important to note that this is not just a review window. I am able to make modifications to the information here as the medical reviewer. One of the beautiful things about this is that on the Temporal View tab, I am able to clearly see the all of the concomitant therapies, past medical histories, laboratory dates, suspect medications, and event dates. And now I can clearly see a small histogram showing me the dates and durations between the event and the suspect products, and I can actually confirm whether the event was indeed treatment emergent. So this Temporal View, if you checked with a number of your medical reviewers, I suspect that you would find that they are doing something similar to this on pieces of paper when you give them the MedWatch to review. Because answering the question, was the event treatment emergent, is kind of a very big clue into looking at relationship between product and event. So some type of drawing or visual record of treatment emergent information is probably being used by your medical reviewers. So this Temporal View actually accommodates that right within the application. And again, we don't have anything like this in the AERS app. Additionally, from the medical review screen, I can attach and view source files, and I can also run any of the individual case safety reports that come with the Argos application. And there are many, many of them. So I can run all of these right here in draft mode. This facilitates the ability for some of your medical reviewers who prefer paper to still open up a MedWatch and perform their medical review right from the MedWatch report. And this is, again, a very key feature and difference between the AERS and Argos application. So let's look at a minute at the regulatory report tracking for individual case safety reports between the two systems. So what you will see is that the screens are very similar in nature. And again, this becomes a subjective opinion. But one of the things that I hear when talking to people who've used both applications is that the Argos application is far more simplistic in its view. So in the Argos application, you'll see folder structures in the upper part of this block. This will allow you to filter. So you expand out down to the country, click on the country, and the lower screen will automatically update and show you only those reports from that regulatory authority. This is opposite in the AERS application, but similar in nature. Now again, we're seeing a technology stack difference here because we're using far more flexible and up-to-date technology in the in the Argos application called ASP. We're able to get graphical, visualized objects that are a little more intuitive to navigate than the old Oracle Forms technology that you're seeing in the AERS application. So again, here's the filter in the AERS application, and here's the filter settings in the Argos application. I think it is very much an appropriate argument to say that it is a lot more intuitive in Argos than in AERS. Even just the simple running of reports is very different between the AERS and the Argos application. So you can see here in the AERS application, we have a quick report screen that is showing us all of the parameters that need to be entered in order to run the report. Many of the clients that we have that are utilizing Oracle AERS struggle with the construct of case version status and back report options. So the back report version and the case status report version are two very complicated concepts for people running AERS standard reports. In Argos, the parameters are far more intuitive, and they match all of the list of values that your users are already familiar with from the case management side. So again, argument is that it is easier to run basic reports in the Argos application as well. Now, from the usability side, the last thing I would like to show you is actually the E2b Transmission Screen in Argos, which is what we call a work list. And when you go here, you'll see that very clearly we can see where the E2b report is along the transmission process. We can see any problems that come up. They are color-coded red or yellow, and we can see the error messages or warning messages that are associated with those color-coded differences. This is a very key and important distinction between the AERS and the Argos application. The E2b transmission is only going to become more and more important as regulations shift and change in the world around us. So having an intuitive E2b screen is a pretty big requirement in most of our implementation projects. Finally, I'd like to show you some of the dashboards that are available in the Argos application that we don't really have in the AERS application at all. You could arguably build these in Oracle Discoverer, but that would take a trained Discoverer person and would likely require an additional Discoverer administration license, because the end user layer that comes with the AERS Discoverer tool application often doesn't have all of the required fields that would be needed to perform some of these complex reports. So here you can see these are all built into the Argos application. This is an expedited report status screen. You can see color coding in this, and the screens are interactive. So for example, if I wanted to drill down into these cases to see exactly why they were late reports, I could double click on them. It would take me to a work list, and then I could clearly see what happened with the individual cases. So again, these types of intuitive dashboard type reports do not come with the AERS application out of the box. You can also create ad hoc line listings and tabulation and graphical reports from Argos directly using the aggregate report area. Now, I will just mention that the graphical reports are a little cumbersome in Argos because the key often overlays the actual graphic itself. So just in the spirit of full disclosure, I wanted to give you that information. However, considering that this is not an additional reporting tool, it does not require additional licensing, and the interfaces are fairly intuitive, it is a very, in my opinion, a very large benefit of the Argos application when compared to AERS. Anyone who's used the Discoverer tool can tell you that it does take some training, it takes some understanding, especially if you want to do complex reports. But here, the ad hoc line listing reports and tabulations are very useful within the Argos app. Let's talk a bit about work lists. I'm only going to focus on two of them right now for the purpose of our talk. That's Work List New and Work List Open. The Work List New is an interface within the Argos application that will allow you to visualize all the cases that have not yet been assigned to an individual or a workflow group for which the user that has logged in has access. And this is an important note because we don't really have anything like this in the AERS application. In a moment, I will show you the closest thing we have, which are what AERS calls the inbox queries. But unlike those queries, which have to be programmed and built sometimes by advanced users in AERS, the Argos application natively integrates with the underlying workflow. So each time a case is passed along a workflow step, it returns to the work list new area and waits for the next person in the workflow to pick it up and use it. The work list open is very similar to work list new, except that it shows me all of the cases that have already been assigned to either a user or a group. And this empowers a company to deal with sickness. If someone is out sick for the day and I need to take over their cases, if we are both part of the same workflow group, I'm capable of seeing their work and picking it up and working with it so that the regulatory reporting timelines are not damaged. Again, the closest thing we have in AERS are the inbox queries. It is theoretically possible for us to create inbox queries that would integrate themselves to a user's permission settings and workflow group in AERS, but I would argue that that query would be extremely complex and certainly not something that a standard case management safety person would be comfortable doing. So again, just a stark difference between the two applications. So lastly, we're just going to look in terms of usability at the Argos J interface, and one of the main key differences between the kanji version of AERS and the Japanese version of Argos, and that is its split screen data entry capability. So in Argos J, unlike the Japanese version of AERS, we are able to pull open the case in Japanese and then with a click of the button display the corresponding English information on a split screen. And this is very helpful, especially if you have people who are non-native speakers or you want to just simply understand more about the Japanese interface and you don't read kanji, katakana, or hiragana. Another key difference in the Japanese version of Argos J is the accommodation of what Japan calls the Japan Pharmaceutical Information Center, or JPIC. JPIC is an organization that scours the research articles in Japan for any potential cases of adverse reactions and stores those articles and potential cases in a data set. And that data set is available for purchase. And in Argos Japan version only, there is a functionality to actually upload the JPEG file into Argos Japan, and then it will allow a Japanese user to scour through those articles visually and locate potential findings that should be cases. So, for example, they can load the JPEG information into the initial screen and then with clicks of buttons decide which of those articles should or should not create corresponding cases in Argos J. This is very helpful due to the PMDA regulations around literature searching that are very different in Japan compared to the rest of the world. So that's pretty much the information around usability, and again, I just want to make sure that you understand that that is subjective. And now I would like to look at just a few differences in terms of administration between the two systems. We're going to look at user-defined fields, how the two systems accommodate this, and why arguably Argos is a little simpler. We'll look at basic code lists and some of the differences between the two systems and how complex and non-complex Argos is compared to AERS. We'll look at the expedited reporting rules, some periodic report maintenance and execution differences, and we'll also look at its Argos's ability to natively integrate to your LDAP server with really no additional software. So let's first look at how to create a user-defined field in Oracle AERS. Well, any of you who have done it know that you have to first access the FAT configuration, you have to locate a custom field available, and then, and this is the part that always frustrated most people we work with, you have to look at a previous field, find the XY coordinates, and then adjust your custom field's XY coordinates accordingly, keeping in mind the height and width values that you've used. So this is definitely not intuitive. I would not argue that this is an intuitive screen. I think it takes training, it takes practice, and certainly that all comes with an internal cost to your organization. If we juxtapose this to the actual methodology used in Argos, we will see that it is far, far, far simpler and would likely result in a huge cost savings. We can activate user-defined fields in Argos in seconds. This is simply not true in AERS. So in Argos, for example, you access the field labeled area from the Argos console, which is the main configuration area. It's essentially the global configuration area of AERS. And when you locate the field, the tab that you want to activate an additional field on, you will see that they're already pre-populated, and they come in date, number, and text field values or types, and then you just pick the appropriate value or type that you want to activate, whether it's a date, a number, or a text. They also have character large object fields. So you can activate these. Now, of course, like everything in life, things that are a little less complicated mean that you have to deal with some limitations. So while it is far less complicated to activate these user-defined fields, one of the downsides is that you have absolutely no control where that field appears. The field appears in the same place always, and you cannot modify that without customization. So this is just one of the drawbacks, but I would still argue that the amount of time you're saving in enabling these user-defined fields is still a very large benefit between the two applications. The codeless maintenance is also a key piece of difference here. We have the AERS application, which has the complicated language values that have to be adhered to, and this is the causal code list in AERS. And here you can see the exact same causal code list in Argos. It's far easier to maintain these code lists in the Argos application. The underlying complexity for E2b transmissions, for example, is all held in the interchange system of Argos. The regulatory reporting rules in AERS are limited in the configuration. You have specific condition syntax that you have to use and specific operators. Now, you can get very clever with these, but they are not intuitive, and they are a bit convoluted to remember and learn. This is very different from the Argos application, where all of the parameters, if you will, for configuring the global regulatory reporting rules are very clearly identified on the screen. You can see those here. And then in addition, we have this really fascinating capability, which is used quite frequently, especially by large companies, the advanced condition, which allows us to really focus these expedited reporting rules on very clear, specific attributes within the case data. So this is a definite benefit between the AERS and the Argos application. For periodic reporting, anyone who's done that in Oracle AERS can tell you the complexity and the convoluted nature of printing and tracking periodic reports within AERS. For Argos, it is far easier. We have a central screen that we go to actually create and generate the periodic report. Within the application itself, we can generate those periodic reports and track their submission all within a particular screen. One of the benefits in latter versions of Argos is that the submission and generation of these periodic reports, which can be very large and could slow down your database and you may take a performance hit, have now been offloaded onto the application server, report server, so that now you will not see a drag on the performance of the application. So this is a very nice additional feature of the Argos application compared to AERS. We also see that the Argos application, unlike AERS, can integrate to your LDAP server very, very easily. We, for example, have had recent clients come to us and ask, how do I have a new LDAP server, I need to reconfigure Argos, but I'm not sure how, and we're concerned that it's going to be very complicated, but realistically it actually is not. You have a single screen, and you just have to make sure that you've set the parameters appropriately. So again, to kind of summarize, in general and again subjectively, the user interface between the Argos and the AERS application are far more simplified in Argos. This likely translates to usability improvements, which then will give you potentially a higher compliance rate in terms of regulatory reporting and case management in general. Again, subjective and an opinion, but this is our practical anecdotal evidence that we've observed over time. We have ad hoc reporting built into the Argos tool that does not require additional licenses nor know-how to execute these reports. And there is a level of configuration administration ease that potentially could allow a safety team to operate and maintain their own safety system compared to Oracle AERS, where a IT or a business IT savvy user really has to be involved in every aspect of configuration. I also wanted to note that there are some additional considerations that we didn't cover in this slide deck that you would also want to look at when deciding to migrate from AERS to Argos. And this may be a good idea for you, and it may not be a good idea for you. So you really need to take a look at all of the benefits that you see from the usability side and weigh those against some of these other aspects, such as license costs. There are differences between the AERS license cost and the Argos license cost. You will also want to look at total cost of ownership. So this would mean looking at the two systems and their server costs, any supplemental software that is required to run those two. For example, Adobe, most of them can run with just Adobe Reader, but Microsoft products are required for the Argos application. So what are those licenses like? All of those things need to be factored into your decision. You also need to look at data migration costs and complexities of the method that you're using for data migration. And also, and an important point, is software life expectancy. So, for example, we know from our presentations that Oracle has made that future enhancements of the AERS application are going to be very focused on the regulatory authority use of the application and may not include necessarily functionality from the perspective of a biopharmaceutical or medical device company. This may have an effect on your decision. You need to take that into your decision-making capabilities. And for technology support limitations, you also need to think about that. There are certain operating systems that are required between the two applications, and those are definitely things that need to be considered when deciding whether to migrate off of AERS and onto Argos. So I think at this point we will open it up for any questions that people may have.
Great. Thank you, Rodney. Feel free to ask your questions via the chat feature, and we'll give it about a minute before to see if we have any questions. And in the meantime, I'll show our contact slide that if you have more information, you can always reach out to Rodney, or you can email our general life sciences info at Perficient email address. You can also reach us at one of the phone numbers depending where you are in the world. Okay. Rodney, do you want to take this question?
Sure. So I see a question. So where does Oracle Argos stand in terms of feature comparison with its closest competitor? And then a follow-up question, which is, who is the probable closest competitor? So I will just generally answer that. Other than comparing Oracle AERS to Oracle Argos here, the closest competitor per se, probably with the Argos application, is obviously AERS Global, AERS-G. That is a whole topic for another webinar, so I can't get into that there in terms of how does it compare to its closest competitor. Again, lots of subjectivity in that particular question. So sorry if that was a cop-out answer, but it's really difficult to answer that without going into some great detail. Is there, and here's another question, is there another system that you are aware of that will be the next system, e.g. after Argos, or is Argos the now gold standard for the next foreseeable future? So that's a very good question, one that was asked considerably at least last year's Oracle Health Science User Group. And I will say that from my perspective, the answers that we got from Oracle were very clear, that Argos is the premier individual case safety management software for Oracle in terms of biopharmaceutical and medical device firms. From a regulatory perspective, that individual case safety reporting tool is Oracle AERS.
Okay, do you want to take the next question?
Yes, I see the next question. It's, in AERS, we can submit multiple reports, but in Argos, we cannot submit another report unless your first report completes. Is parallel reporting processing going to be added to Argos in later versions? So I must admit I'm a little confused by the question, but that's probably just me. So let me take a minute to reread it. Yes, I'm not sure if this is in regards to individual case safety reporting or in terms of periodic reporting. I will say I don't know what version of Argos you are working on either, but in later versions of Argos, for periodic reporting, as my slide said, you are offloading those onto the report server, and so it is possible to submit multiple reports simultaneously. They will queue up, and then they will run in order of execution. If you were talking about individual case safety reporting, why don't we take that offline and I can give you more information and respond to you then.
Okay, we'll give it another minute or 30 seconds for additional questions. Okay, it looks like we don't have any more questions, so that'll end our Q&A session. If you do have additional questions after the webinar takes place, feel free to contact us. Please note that today's recording of the webinar will be sent to you within 24 hours for you to review and share with your colleagues. We'd like to thank you for your participation and hope that the information we provided you with today was helpful. Feel free to join us for our upcoming webinars, which can be found on Perficient's website. Thank you so much for joining. Have a great rest of the day and evening.
Thank you, everyone.